Greetings, friends and followers. This is Nurses Talking. I am Dale Barzy. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. And today, I am very, very pleased to welcome Belkis Gil from Florida, USA. Belkis is an emergency room nurse. She's a legal nurse consultant and she's a private nurse concierge. So she's an entrepreneur.
Yeah.
Welcome, 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 Belkis.
Thank you for having me, Dale. It's a pleasure.
My absolute pleasure. So, what brought you into nursing?
Oh man, it really was a calling. Before I was a registered nurse, I was a medical assistant. I did that for a little while. I had little kids, and I one day woke up and I was like, I am really good at this. Something I just kind of recognized. I was like, I'm really good at this. I love helping people. I love talking to people. I love educating. I love medicine. It was just a natural calling. And I went to nursing school and everything just lined up perfectly for me to go through with the nursing school. And that was that.
All the planets just aligned for you.
It
That's awesome.
really did. It really did. It just aligned perfectly. I can't say I had I had some rough times, but it was just a perfect journey. Exactly what I needed.
Excellent, excellent. And you said you had some rough times. I was just about to ask you what the challenges were because this is you started something, true, you continued within the same vein, but you're now a mom, you have young kids. So what were the challenges for you?
Oh man. So my children were both under 10 at the time. And I was a single mom. So just having a full-time job, um, going to school, being a mother, picking them up from school, dropping them off. A lot of times they were at school with me. It was the most beautiful thing how I said everything aligned. My professors were so good. They were like, just bring them to class. And they would sit in the back of the classroom doing their homework and just reading. I'm like, you guys read your books, mommy's in class. And they would just behave. They would just sit there and they became part of the group. Once I was in actual nursing school, they were part of my cohort. Everyone was like, the kids. It was really cute. They were part of my cohort. We went through the journey together. Um, you know, uh, it was very difficult to play with them and be a mom and do all those things. So I just kind of brought them into my world in nursing, and they loved it. And I mean, my oldest is 22 now, and he's like, Mom, just watching you going to school, it really motivated me to do this. And it
Yeah,
really was. It was ups and downs, but I no regrets at all. No regrets
yeah.
at all.
What an example you set. So,
Yeah.
so what kind of areas did you work?
So I started in the cardiac floor when I was a newbie nurse, and I started on nights, which was challenging on its own,
Mm,
being a single mom and everything. And then I transitioned to the emergency room once I was about 2 years in and into trauma, and I absolutely fell in love with emergency room care. I'm happy that I did the cardiac first. As a new nurse, I think the floor nursing was really good. You got to know your meds, you got to know how the hospital system works, because I'd never worked in a hospital setting
mhm.
before, to know the doctors, even the charting system, and just get comfortable. And once I was comfortable, I transitioned to the ER, and it was an easier transition than coming in as a new nurse.
Mm-hmm. Mm-hmm.
Yeah. Prior to
Yeah.
that, I did OBGYN, and I did a lot of rheumatology, which I do now. I do infusions as well,
Mm-hmm.
per diem with rheumatology medications. But emergency room and trauma is definitely my bulk.
That's what gets you a little heart going, huh?
Weirdly.
Okay, okay, okay. So you love the emergency room, but you also are, as I said, you're a concierge nurse.
Hmm.
So that, the emergency room nurse is things going through, Choop, 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 choop,
In and out.
and then now
Hmm.
you're a concierge nurse. You're kind of like one-on-one.
Mm-hmm.
Like, here and here and here, because this is adrenaline. This is I guess the adrenaline can be going too, but you're kind of like, you're in charge, you're in control, you know what you're doing. Nothing is coming at you unexpected. Man, how
Right.
do you marry those two?
Oh my goodness. So it's definitely creates a balance for me personally. So, like you
Mhm.
said, the emergency room is adrenaline. You're always like up here, all the time, which I like. But then a part of you, as you're getting older, you kind of want a little bit more of a calmer environment.
Yeah.
Throughout my time in the emergency room, I noticed there's a big gap in healthcare, somewhere in the middle. I'm in South Florida, so we have a big elderly population here.
Okay.
You start seeing a lot of the same elderly people over and over. They're forgetting to take their meds. They're messing up their medications, or families in New York or wherever up north. And there's nobody really there for them. There's nobody there to, something so simple as, take this medication instead of this one, or remember this was what you're supposed to be taking, or not being able to follow up with their primary care doctors, or they don't have a ride, or whatever it is. There were a lot of things. Or the wife has dementia, but she's okay physically, and the husband doesn't have dementia, but he's not okay physically. So I started seeing a lot of that same pattern over and over and over, and I was like, man, there really isn't a person in between, to help
Yeah.
um, bridge that gap. Even when you speak to the family members, I have these patients for a few hours in the ER, but I build a relationship with them. I'm a relationship builder. I don't know, but I build a relationship with them and with the families, and a lot of it, it's we're not there, and we don't know what she's
Yeah.
doing and what's going on, and she's messing up her medications. She forgot to follow up and things like that. So I was like, maybe we can do something about that. And that's where the concierge came in. I also love just, building relationships with people, educating, helping. Ultimately, that's what nursing is, right? You're there for one another, basically.
Yeah. 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 So for anyone who doesn't know, what exactly, so there's a difference, right, between being a concierge nurse and being a home care nurse.
Hmm.
What would you say is the difference?
Concierge is definitely more one-on-one. And home care is more like Medicare guidelines, what they'll pay for, what they won't pay for, what
Hmm.
you can and cannot do. Concierge is private, right? So we have a little more wiggle room to what are your needs and how can I meet your needs, versus being told, oh, this is the only thing you can do.
Yes, and that gives you a whole lot more autonomy to,
Absolutely.
yeah, to
Absolutely.
take care of the patient as, as it presents to you.
Hmm.
Yeah, yeah. And so, in addition to this, my dear, you're a legal nurse consultant.
Yes. Yes.
What brought you there?
Um, it was the strangest thing. So I was kind of on YouTube, and somehow I ended up on legal nurse consulting YouTube. You know how your algorithm
Yeah,
kind of goes, and I started looking into it and reading it, and I was like, wow, this is really interesting. And a lot of it is because there are yeah, I've never had a legal case, thankfully, but I have spoken to people who have had legal cases pop up from 5 years ago, and anything that the charting was misunderstood by some non-medical person. And I have, you hear about it, but
yeah.
and it's actually a very sad thing when you try to explain yourself and they're like, well, if it wasn't charted, then it didn't happen. And I was like, wow, this is actually, I didn't realize it was a field. I didn't realize it
Mhm.
was a thing at all. So I started looking into it and I loved it. I took some courses. It's still, it's something you have to educate yourself constantly on. I started
Yeah.
reading books
Hmm.
and reaching out to people and networking. And that's kind of how that came about. I was like, this is something very interesting and important to us as nurses, to have someone on your side. Not always does the hospital cover you, when things happen.
Hmm.
So to be able to say, hey, no, this is not, this doesn't look like this is what happens. This was written in black and white, but if you don't have the medical background and the experience, you can't really interpret the situation.
Yeah, yeah, yeah. And this is one of the things that I have said to nurses frequently is that your documentation needs to say, needs to get across what happened. Right now, if I read it tomorrow, I should understand what happened. If I
Right.
read it 6 months from now, I should understand what happened. Or if I read
Right.
it 10 years from now, I should understand what happened. So
Right.
your documentation needs to be the kind of documentation that tells me clearly what happened.
Absolutely. That's actually one of my biggest things when I'm mentoring new nurses or just new
Mm-hmm.
nurses in general. Just, hey, document that. Even if it's the smallest thing, if it's something that can potentially become a problem or
Yeah,
anything, definitely document it. I mean, it takes a couple of minutes, it doesn't take much out of your time to just, document something,
right,
any
right.
incident, event, physicians aware, the patient's condition at discharge or when they came in or how their condition changed and
Yeah.
what did you do and who was there and all of
So,
that. Those
yeah,
are really
yeah,
important things.
yeah, yeah. All of those things are necessary and
Absolutely.
important. And I say we've come to the place where we're practicing defensive nursing, whether we want to believe it or not. But
Hmm.
we do. You have to. You have. It protects you. It also protects your patient.
Absolutely. Absolutely. It protects both of us.
Mhm. What would you like to see change? You've been a nurse now for a little while.
Hmm.
What would you like to see change in nursing? How do you think we can do it?
Oh man. Well, definitely what you're doing, connecting nurses around. I think that's something that we as nurses, as a community, which should work on to be stronger at that. You see firefighters are have a brotherhood, cops have
Yeah,
a brotherhood, but nurses don't necessarily have a sisterhood.
yeah, yeah.
And I think we're better now, but I think it's something we should work on, just having a stronger nursing community that
Hmm.
we're
Hmm.
for nurses, by nurses. I think that definitely would like to see that change. I would like to see administration focus more on, uh, nursing care, us versus what the hospital, your bottle of water is here. Like, that's not important. My patient's coding, like, because my bottle of water is here, like, just things like that. Like, just let's focus on what's important. How can we take care of our patients? How can we take care of our nurses?
Yes.
And how
Hmm.
can we take care of each other? That's definitely one of the biggest things I would like to see changed for sure.
Yeah, yeah. We've got to develop a culture. I don't even want to say a culture of caring because we're here because we care.
Hmm.
But our caring is always directed a lot at our patients, and there's nothing wrong with that. But we need to be directing some of that care to our community, I think.
Right, to each other, to each other.
Yeah.
Nurses for nurses.
It's good. It's good. It's a good topic. Yes. Yeah. I think I like that. What would you say? You've done a lot. So what would you say is your greatest achievement so far?
Oh man, a lot of little things, but
Hmm.
definitely inspiring newer nurses or just people to become nurses. Um, being a young mom and a single young mom and going through the nursing process, I was able to, once I was finished, I had 3 or 4 people just say, "Oh my god, I've always wanted to be a nurse. I never thought I could do it. I was always so scared to go back to school, and then I just saw you kinda just do it, and you did it, and there you are." And those 3 other women are nurses now. They're all OB nurses, which is cute. Um,
Yeah.
so just inspiring other nurses and teaching. I love teaching. Eventually I'll probably, be a professor, but I love
Mhm.
teaching, the right way to do things, taking care of your patients and also taking care of yourself. I've had tons of new nurses just say, I am so happy that you were my mentor and my teacher and my
Mhm. Mhm.
educator and everything. And that just, it makes you feel good. It makes you feel good that you were able to help somebody else.
Yep. Yep. It helps you get up and get dressed and go the same path the next
Yep,
day.
it does. It really does.
Yeah, it does. What do you think you see nursing looking like in about, the next decade or so?
That is interesting. I would hope to see the nursing community to be much stronger. Um, I see a lot of I It's interesting. So a lot of the, how we're getting into the AI, era.
Mhm.
Um, I didn't know that this was a thing, but I went upstairs to take a patient to the ICU, and I was walking by the med surge floor, and I saw a little robot coming to patients' room delivering medications, and I didn't realize we had that. I didn't know that there was a little robot delivering medications to the patient's room, like they're scheduled meds, not a nurse.
Delivered it directly to the patient?
The patient's rooms, yeah, yeah, and I didn't know that that was something that they were doing, which was very interesting. So it made me think. I was like, wow, is that, are they taking away some of our responsibilities to focus on more of the caring part of nursing? It made me think about that. What are we
Yeah,
doing? So that's
yeah,
actually an
yeah.
interesting question that because I see some of that being incorporated into our jobs in the hospital.
Because, as you said that, and the reason I asked if you deliver it directly, I mean, immediately I thought of some meds that you want to do some vitals before you even administer these meds.
Right.
And so my my question to myself was, how did this happen? How did that part happen?
Yeah, I don't
Um,
know. It's very interesting. There are a lot of medications you want to assess the patient before,
yeah,
or
yeah. You want to do
else
some
look
assessment
at the
first.
labs. Absolutely. Absolutely. Is it appropriate to even give them this blood pressure medication when their
Hmm.
systolic pressure is 90, things like that.
Exactly. Exactly.
Yeah. So very, very interesting how that
Hmm.
may
That
or may not.
bears some that bears some further probing. I want to know how that happened, how that works.
Yeah, yeah, we'll see, I guess, to be continued.
Mm. So you came into nursing a little later. You already had kids. What? And now you mentor and educate. So what advice do you give to people who want to be a nurse? Like the three
Oh, man.
ladies who said, I saw you do it.
Yes, yes. Definitely just do it. Hang on there. You will get through it. Go into nursing because you care and love to take care of people primarily. There's just so many challenges with nursing. And I think nursing school is the hardest undergrad that there is. And I could be wrong, but I really do think that it's very difficult. So it's very challenging. So if your heart is not in it, I don't know if it's going to be a successful career path at that point. So I think your heart needs to be in it, into caring for people. And that will give you the strength to be able to battle the challenges that come with that.
Yeah, yeah, yeah. You to get past that, you've really got to have some fortitude, and someone needs to tell you that there are some days when you're gonna think, I am so done.
So done. Oh, yeah.
And then, surprise, surprise, you get up the next day and you go right back to it.
And you do it all over again and you do well.
Yeah, you do well. So, in all of this, what about, we've been talking a lot these days, as particularly post pandemic, we're talking a lot about burnout among, healthcare. We're talking about nurses. I believe a lot of it, I understand that a lot of it comes from institutional, you know, um, what is it? Policies and the way it's set up. A lot of it comes from that. A lot of it comes from stuff outside. But I believe a lot of it comes from us
Hmm.
not taking care of ourselves or not recognizing that we need to take care of ourselves.
Right.
So, what does self-care mean to you?
Oh, self-care. A few things. So definitely, working in the emergency room, you're constantly up here. You
Mhm.
don't know what's coming through the door. Some hospitals don't have a cap between a ratio with nurse and patient
Mhm.
ratio. So I've had, 7 patients in the ER, 3 intubated, 2 sites, 1 having a heart attack, 1 coding, things like that. So you're constantly up here. What I had to learn all on my own was that it's okay to step away for 3 to 5 minutes. Walk away, go sit down, take a couple of deep breaths, drink some water,
Mhm.
use the restroom, and then come back and it's okay. If you don't do that, you are just not going to be okay at 7 p.m. or 7 a.m. You're not
Yeah,
going to be okay.
I know.
And then on your days off, disconnect. Disconnect. I think disconnecting from nursing, not bringing home, what happened at work is huge. Leave work at work, come home, take care of your family, yourself, and relax. For me, that's the gym, um, reading, and massages.
Well,
I think, I talk to lots of nurses and no one goes and gets a massage. I'm like, you need to at least go once a month and get a massage. Super important. But
yeah,
finding a hobby or something that you love. I love working out, so that's my thing. But whatever that is, crocheting or whatever it is that can disconnect you completely from nursing.
yeah.
Super important. And taking micro breaks during your shift.
Yeah, yeah. That disconnecting though, can be difficult.
Hmm.
I know for myself that I had to find a physical mechanism for disconnecting. I mean, they say, leave work at work, and when you clock out, you leave it. That it needed for me a little more than clocking out. It needed for me the whole process of changing clothes
Yeah.
and I had to do that
Yes.
in order to give myself almost to give myself a new persona.
Yeah,
Right?
absolutely.
To go, yeah,
Yeah, in order
it's
to
not,
disconnect, whatever it takes, get
mhm.
out of your scrubs, take that long shower, listen
Yeah,
to soft music, take 5 deep breaths. And I think that we as people just don't take a minute to just breathe. And as nurses, that's super important.
absolutely breathe. Breathe. And my thing is breathe, especially, and no one tells you, for example, in essence, no one tells you that you're going to be angry.
Oh yeah. No one tells you that. That is very true. And you will be angry.
And so when you I tell students, when you are angry, the minute you get, that's when you breathe.
Breathe.
There you breathe. Yeah.
Breathe. Take 5 deep breaths and reset.
So I think of nurses as really very, very special people. I mean, I've spent my whole life being, my whole adult life being a nurse and coming into contact with so many different nurses. I have had the good fortune to work in many different areas and B, different countries. So I come up against, even culturally, when people are different, still there is this special thing about
Yes.
nurses.
Yes.
So if you had to tell me in one word what you see as the most essential quality of a nurse, what would that word be?
Oh, definitely dedication
Dedication. Hmm?
and care.
Dedication and care. Hmm.
Yeah, I think those two things. I think nurses, like you said, we're very special. We're very dedicated to taking so much of ourselves and putting it to a total stranger.
Yeah,
We all do
yeah,
it. We
yeah,
all do it.
yeah.
Yeah.
We
And
all
and
do
not
it.
all nurses do it, not, all people, but all nurses do that.
Yeah,
This is a perfect stranger and I'm, especially in the ER, I'm all in there.
you're all in. You're all in.
Yeah.
And it's not, you're all in without even thinking about it.
Without even thinking about it, not once. You don't know this person, you don't know their first name, you don't know where they've been, nothing about them, but you're all in to help.
Yeah, you're all in. And that's what's so very special. And that's what makes me want to just nurses.
Yes. Absolutely.
Belkis, before we go, any gem you'd like to leave us with? Any special words?
Oh man. Any new nurses out there, don't give up. It's gonna get better. Just give it time. Seek advice from, older nurses and always look for, don't stop at one place. If you started med surge and you feel like you've, learned everything you were going to learn there, it's okay to move on. It's okay to, see different aspects of nursing. That's the beauty of nursing, is there's so many different things you can do. So,
Yes.
get on, LinkedIn or YouTube and see what other nurses are doing, and see how you can, join the community and help, and, just don't stop. Don't stop
Yeah.
learning. Don't stop, building yourself and helping others.
Yeah. 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 What I've started telling this is that, maybe they don't see it yet, but they're planted in a very special place. So just go ahead and flower.
Absolutely.
Belkis, thank you so very, very much for this conversation. I truly enjoyed it. Thank you.
Thank you for having me. Have a good one.
You too.